everyone, and thanks for tuning in to Beats Research Radio, a podcast and YouTube channel that aims to disseminate science and research to the community. My name is Nicole Chu, an undergraduate student from the University of Ottawa, and I'll be your host on today's episode. Joining us is Dr. Javed Butler. Dr. Butler is the president of the Baylor Scott and White Research Institute and senior vice president for the Baylor Scott and White Health in Dallas, Texas. He currently holds the Maxwell A. and Gayle H. Clampitt Endowed Chair for Research. He is also the Distinguished Professor of Medicine at the University of Mississippi. Dr. Butler is board certified in cardiovascular medicine and advanced heart failure and transplant medicine. His research interests focus on clinical trials in patients with heart failure. He serves on several national committees for the American College of Cardiology, American Heart Association, National Institutes of Health, and the Heart Failure Society of America. Dr. Butler, we are honored to have you on Beats Research Radio today.
You're too kind. I'm delighted to be here.
Thank you so much. So to start off our conversation, can you tell us what inspired you to become a heart failure physician?
Yeah, I mean, I can give you an incredibly precise answer because I know exactly the moment I decided to become a heart failure doctor. I was actually going to become a hepatologist. So, way back when in the 1990s, when you used to apply for training, during residency, people did sort of electives in that particular specialties to get letters and stuff like that. And my entire sort of trajectory was gastrointestinal diseases, focusing on hepatology. And then somebody by the name of Milton Packer, who was at Columbia, came and gave grand rounds at Yale. And I was this sort of, second year resident sitting in the audience. And I was just simply absolutely awed by that grand round. So literally that one grand round sort of changed my entire trajectory. Then I did a bunch of cardiology electives, and here I am, 2.5 decades later. And what's very interesting is that Dr. Packer and I now work in the same department in the same institution.
Wow, what a small world moment. And the fact that you can pinpoint that one lecture is truly, really interesting. Thank you so much for sharing. So, as you mentioned, your research interests focus on clinical trials in patients with heart failure, and you recently published a clinical trial called EMPACT-MI, focusing on the impact of empagliflozin after heart attack. So, for those who may not know, what is this drug and how does it relate to heart failure?
Yeah, so empagliflozin is a drug that belongs to a class of drugs called SGLT2 inhibitors, sodium glucose cotransporter inhibitors, so SGLT2 inhibitors that have been tested in actually various different disease states. So they have been shown to reduce the risk of heart failure development in patients who are at high risk with type 2 diabetes. They've been shown to reduce the risk of heart failure in patients with chronic kidney disease. So that is for people who don't have heart failure, prevention of heart failure. And then people who already have heart failure, when you give this drug, it has been shown that it reduces the risk of you coming back into the hospital with more sort of worsening heart failure or the risk of dying. So we have sort of on one end prevention of heart failure and on the other hand treatment of heart failure. What is sort of missing in the middle are people who present with acute myocardial infarction, which is commonly called heart attack. So when people present with heart attack, they are at a particularly higher risk of developing heart failure. And now the question is, that in high risk but not acute patients, these things work, and these things work for treatment. But what about high risk acute patient? Is it safe? And will it be as effective as we have seen in these other two populations? And that was the reason why we did this clinical trial.
I see. Thank you for sharing. And can you give us some of the major findings from the results of your study?
Yeah, so we had a bunch of learning on this trial. So the primary endpoint was all-cause mortality or heart failure hospitalization. In other words, will giving this drug in the face of acute heart attack prevent your risk of dying or lower the risk of dying and prevent the risk of developing heart failure. So the glass is half full and half empty. We found no reduction in mortality. So that is sort of one lesson learned, that what happens in the face of acute heart attack, early mortality remain related to myocardial infarction itself, that seems to not be affected by this therapy. But what was significantly affected was lowering the risk of developing heart failure. In other words, it doesn't affect the acute effect of the heart attack, but the long-term effect of the heart attack on the heart and the risk of heart dysfunction and developing heart failure. All of those risks were reduced by about 25 to 30% relative risk reduction. So to summarize, the heart failure benefit that we saw in diabetes and CKD on one end and on heart failure on the other end, now we can fill that in the middle as well, that patients who come in with heart attack, your risk of developing a heart failure goes down when you take this medication, right when you're sort of early phase of the heart attack. But we did not find any evidence that it lowers the risk of mortality. So then the question comes up, well, if heart failure is such a big risk factor for dying, and if you're reducing the risk of heart failure, why are you not seeing the benefit in mortality? That sort of is the obvious question. And I think it's a matter of timing, because the entire trial was about a year and a half long, and the follow-up after heart failure developed on average was not even a year. So I think the way the trial was done, acute mortality or acute risk of dying is not affected by the drug, and we cannot in the trial look at the effect on dying in the long run because we did not have the long-term follow-up.
I see. Thank you for sharing. And in terms of the future directions after this impact MI clinical trial, do you mind sharing some of the next steps from these results?
Yeah, so the next step is, obviously dissemination of the results. So we need to sort of make the clinicians understand. As a clinical trialist, you're always too close to the data, so you are sort of, you think that the whole world sort of knows about it, and that's obviously not the answer. So to understand the importance of heart attack, to understand the importance of heart failure, to understand the importance of these data, that will require some effort at the professional level. So that is sort of the immediate next step. And then in the long run, even with SGLT2 inhibitors given, there is substantial residual risk. So the glass half full is that if the risk of dying or developing heart failure or having another heart attack after a heart attack was here, 20 years ago, it was here 10 years ago, it is here today. So we have made a big, dent in the right direction. The problem is that there is still this much risk left, right? So our work is not done. So the question is, what are the other therapies that we can do so that we can continue to lower the risk and not sort of call it a victory and just sit. So hopefully the research will continue to go on.
Yeah, I see that glass half full aspect. And kind of like jumping off of this last point that you mentioned, in terms of your opinion, what are the future directions moving forward in the landscape of heart failure therapies? Where do you see that heading?
Yeah, so that's a really, really interesting question, and I think the future looks incredibly bright, but at the same time incredibly different, right? So there are two or three things that are happening in the external world that will impact things in a very, very transformational pattern. If I look at back in my career, things were all sort of incremental. You put one brick over another, over another, over another, and sort of try to build something. Now, what's happening? One is this whole uh, omics. So whether it's genomics, proteomics, metabolomics, all sort of the omics revolution in cell biology and technologies, evolution in immunology, gene therapy, CRISPR therapy, all of those things will be sort of affecting drug development and device development and therapy development in a very fundamental way beyond sort of the small molecules or the pills that we have been giving. So these biological agents and whatnot can really literally change the fundamental biology of the disease. So that is on one hand. The other hand is the compute technology and AI. And what is the role that AI and the compute technology will play for all of these vast sets of data that human brain is sort of really limited in how much you can understand, but also how much you can assimilate at any given time. So that's the second thing. And then the third is the implementation part, right? So I am not a specialist, I'm a subspecialist, right? So you do internal medicine training, then you do cardiology training, then you're only doing heart failure. And I can tell you today, even for heart failure, it is becoming close to impossible to follow up with all the literature, right? So in heart failure, you have heart failure, you have HFrEF, HFpEF, transplant, pulmonary hypertension, all that kind of stuff. It's really wide. So what role, how will we be giving medical treatment in the future? What is the role of sensors and devices and physiologic 24/7 measurement and incorporating that with all the knowledge we have? And how much of the care patterns will be shifted remotely and at home? So this whole thing that we ask patients to come to our clinic so that we can measure their blood pressure and give them a pill, that's going to be thing of the past. I mean, a lot of these things will be automated. A lot of these things will be at patient's home. So delivery of care model, AI and data integration, and then the whole omics and the cell biology advances. It's going to be a different world.
Yeah, thank you so much for sharing. Definitely the gene editing, omics, AI, as well as implementation of this care is definitely going to change in the future years. So, for our final question to wrap up our conversation, do you have any words of wisdom that you could share for early career professionals who are interested in a field of cardiology or heart failure?
Yeah, I mean, I would say a few things. One, you only live once, so one has to enjoy life, and therefore it's really important to do what you really like doing. So I think that success in any dimension, whether you are measuring success by notoriety, popularity, number of papers, your bank account, whatever your measure is for success, that has to be a secondary product, but cannot be the primary goal. I think trying to chase success is just a bad idea. Following your passion and what you really like to do and getting really good at something that you're passionate about, and then success will kind of follow. So success is a derivative, not the goal per se. One life, just do whatever you do, but do it with total passion. But humility is important. At the end of the day, we know much less than what we don't know. So humility is important, and kindness is important. So yes, science is great, but kindness and humility are important. So I hope I'm not standing on my soapbox too much, but I would summarize by saying, do what you like to do it with humility and kindness, and don't chase success. Success will follow.
Wow, thank you so much, Dr. Butler. That was definitely very inspirational and insightful, those two pieces of wisdom that you shared.
Thank you very much.
Yeah, and thank you so much for joining us today for this discussion. It was definitely an honor to have you on our channel.
My pleasure. Thank you so much for talking with me.
And thank you to all our Beats Research Radio listeners. On behalf of our radio director, Dr. Emilio Alarcon, as well as our whole Beats Research Radio team, we thank you all for tuning in. Don't forget to follow us on Twitter, Instagram, and YouTube at Beats Research to stay in the loop of our recent uploads. Wishing everyone good health. We hope to see you all next time.